Hello, I'm Heather Nielsen, and I'm here to tell you about my health education and promotion philosophy, which is to empower the next generation of students to foster respectful relationships that will encourage them to seek knowledge, apply critical thinking skills, and achieve complete wellness. In return, our communities will be filled with productive citizens, active parents, and resilient people. In the following slides, I will explain how I came to this philosophy. I will define my goals as a health educator, my plan for how to reach my goals, and my future as a health education specialist. My philosophy is based on my beliefs in creating a society where my children can be safe and thrive. I can influence how families live, work, and play in our community by educating my current high school students. My students will be future citizens in our community. Understanding how the crumbling of the family structures affect our students' mental health and future chronic disease is essential as a health educator working in the school setting. Today's educators know how students' ACE scores impact their learning along with their mental and physical health. ACE stands for Adverse Childhood Experiences. Many ACE risk factors are generational cycles of abuse, neglect, and household dysfunction. An increase in ACE scores can result in chronic diseases such as depressive disorder, COPD from smoking, asthma, kidney disease, stroke, cancer, coronary heart disease, diabetes, and obesity. Studying social trends and assessing what skill sets need to be enhanced at the high school level build the foundation for my goals to educate students to become productive citizens, actively engage parents in the future, and feel satisfied with their life. If you want to know more about ACEs, feel free to click the link. My children are at the bottom wearing our school Wildcat colors, and they are the reason behind my drive to become a certified health education specialist. What is your reason behind your drive or desire to become a health education specialist? I can achieve success by focusing on the three main goals from my philosophy, which are to educate students so they can be productive citizens, actively engage parents in the future, and feel satisfied with their life. Students need to contribute positively to our community based on their skill set. I advocate for trade skill courses to be offered at our high school and present different health based careers during my classes throughout the school year. They also need to learn how to be engaged parents so their children can thrive and stop generational cycles of abuse and chronic disease. Adding lesson plans around parenting styles can help students assess which style will be most beneficial for them to use when they become parents. Students must learn effective communication and conflict management skills to have healthy, nonviolent relationships with others. They may not have positive role models in their life that demonstrate what a healthy relationship looks like. They need to take the initiative to take control over their health by assessing their total wellness and researching effective ways of self improvement. One step in self improvement is to learn to evaluate services and products to know how using these products may affect their health, such as the development of electronic cigarettes or vapes. When they were first released, the first year I started teaching, they thought to be safe and only contained water vapor. As I have continued to educate the youth, they can now make the connections between regular cigarettes and vapes. Social media marketing has made it more challenging to get accurate information out. Finally, they need to understand how their complete wellness can impact their everyday lives and increase their life satisfaction. Students need skills to enhance their personal growth in social, physical, intellectual, emotional, environmental, and spiritual well being areas. Teaching the main components can be the stepping stone to stopping the cycle of chronic disease. But I can't achieve this success by myself. I will need community support. Acknowledging personal limitations, it's critical to find current data for students to make informed decisions. Bringing in community professionals can stimulate kids and give them the most accurate data to make informed choices. The National Guard has been an excellent resource for our students to learn mental health resiliency. The majority of the National Guard training is focused on mental health. Community family resources, domestic sexual assault outreach, and public health have provided substance abuse prevention, healthy relationship characteristics, and sexual health topical presentations with updated and current statistics for our area. For example, Iowa has seen a 55% increase in syphilis. It is an STD that can lead to death without treatment. Humboldt County has also been impacted by different drug abuse trends, such as fentanyl-laced marijuana. This is why I find it most valuable to bring in experts regarding STD and drug abuse trends. As the data can change rapidly, students can use this data to protect their bodies from illness, disease, or death by understanding what is happening in our community, knowing risk factors, and practicing prevention steps. After understanding these trends, students can make informed decisions. I have also used our local dietitian to create freezer meal nights for our staff during conference week. I will be discussing this later on. I have big goals for our community, and I can be a significant asset by becoming a certified health education specialist. My professional goals in the school setting have been solidified by Dr. Wynn's Lifeline book. I am on the front lines educating future generations to break the cycle of abuse and chronic disease. I've been a health educator for the last 10 years, and I continue to learn effective teaching methods and acquire new ideas from collaborating with people like you. Dr. Wynn pushed for collaboration within your field, and I've enjoyed reading and working with you as I've used some of your insight and ideas from this class and this book to implement my school to benefit students and staff. I'm excited to what I can offer to my district after completing this master's program and receiving my CHES certification. I will continue to need professional development, and I can get that by joining a professional organization. I will be joining the Society of Health Education Educators organization to stay current with trends, attend professional development opportunities on effective teaching methods, and utilize their online tools. This organization has the largest membership base. Being the only health educator in my district, networking with other health educators will be very useful. You can click on the SHAPE link if you are interested or want more information. What organization are you planning on joining? When I become certified, I can utilize the 8 responsibilities to support staff, which then can support our students and help me achieve my goals. Being a health education specialist will also impact my workers and more in the community. Applying the 8 responsibilities to assess, design, and implement wellness plans for staff will help decrease teacher burnout, decrease personal medical bills from chronic diseases, and create a positive work environment. Teacher burnout is at its highest peak, and I hope by advocating for teachers' mental health and wellness, their quality of life will improve, and in return, they will be able to provide more support for our students. I lead our district's wellness team, and at the end of last year, we surveyed the staff's personal needs. We implemented new activities this year by advocating for those needs. The district graciously agreed to pay a part of the wellness blood screening test available for staff during our flu clinics, incorporate Wellness Wednesdays, and provide more time for staff to complete personal tasks during this busy holiday season. On Wednesdays, our school district is dismissed an hour earlier for staff professional development. In December, the staff is allowed to wear classy workout wear if they are more active in their classrooms and provide students with more classroom movement choices. Also for December, to help decrease stress during this busy time, staff are allowed to work on personal work instead of only school-related work. This time can be used to set up appointments, finish up holiday cards, or time to decompress by visiting with other staff members. To help initiate wellness, our district has brought in healthier lunch options during our all-day professional development. This encourages staff to eat as a family, collaborate, ask questions, and have healthy food options instead of fast food meals. We also collaborated with our local dietitian and hospital for a freezer meal night during the week of conferences. These are healthy freezer meals staff can buy so they don't have to stress about cooking when working long hours at conferences. As I continue through this master program, I want to become the change agent for my school district and community. I look forward to watching my community shift based on programs I can help implement, adjusting my instruction to educate students on communication and conflict management skills, the benefits and harms of parenting styles, and the ability to think critically. Health products and services are constantly changing, and kids need to be updated on information to make informed decisions. When students become productive citizens, actively engaged parents, and resilient, communities will flourish, chronic disease will decrease, and their quality of life will increase. I can also help support coworkers with their health journeys by advocating for their needs. Making small changes at school level can lead to big changes felt by all. If you also want to become a change agent in your community, click the link to learn more. Think about what you can do today to make a better tomorrow for yourself and for those around you. Here are the list of my references.